Hi, there is a new tool to help keep you healthy. This is Dr. Gregory Charlop, and I am the author of Why Doctors Skip Breakfast. And I want to talk to you today about the new Apple Watch 6 and Fitness Plus. Now, I have no financial relationship with Apple, but I want to share some news. And I have to admit, I have not been an Apple Watch fan. I've never owned one before. It's not something that I personally wanted to just have more gizmos. But I think the Apple Watch 6 is a real game changer, and I'm going to recommend it. And I recommend it to my wellness patients. And here's why. First of all, it has a very advanced fitness tracker. So you'll know, and a lot of things have this, I understand, but you'll know how far you've walked and everything else. But it keeps track of your heart rate and your heart rhythm, so you'll know whether you have any abnormal heart rhythms, which is a big deal, especially these days, because it's hard to go to the doctor's office. The thing even has an EKG, so you could measure your EKG, and if you know how to interpret it, you could look at that. There are apps that will help you, or it'll be very helpful to your doctor because you can send the EKG to the doctor, again, saving you from having to go into the office. But the two things that I really like about the Apple Watch 6 is that it has an oxygen monitor. And an oxygen monitor helps you know whether you're getting enough oxygen in your body during the day, and even more importantly, at night. So it can measure things like if you have many types of lung disease, it'll show up because your oxygen levels will be low. But the thing that really excites me about the oxygen monitor is you can use it overnight and potentially it'll help you figure out if you have something called obstructive sleep apnea. Now, we talk a lot about obstructive sleep apnea and why doctors skip breakfast. Sleep apnea is one of the most dangerous things. It's shortening your life. It's bad for your heart. It even increases your risk of having Alzheimer's and other brain diseases. So if you have obstructive sleep apnea, you want to figure it out and treat it. When you use something like the Apple Watch that measures your oxygen level at night, that'll help give you insight, because when you have obstructive sleep apnea, what you're really doing is you're suffocating overnight. And you want to figure that out if you're not breathing well overnight, if your oxygen levels are falling, because you're starving your brain and your other tissues of oxygen. Once you identify that, then you could go ahead and go to your doctor and get the right treatment for your sleep apnea. So it's a great way to figure out if you have a disease like that. The other thing about the Apple Watch that I like is it's integrated with this new service, Fitness Plus. Now, unfortunately, if you're anything like me, and you like to go to the gym, it's hard to do that now because the gyms are largely closed. And even if the gyms are open, I'm personally kind of afraid to go into them because of COVID. Now, the question is, are exercise routines suffering? Are we not working out as much as we should be because we can't go to the gym? Well, thanks to Fitness Plus, what it does is they have all these great trainers and they have these videos and things, and you can exercise along with your watch and the videos. So the videos show you what you should be doing, and the watch connects to it to see if you're getting your heart rate up and you're burning the amount of calories you should be. So it helps motivate you, and it helps know if you're actually getting what you should be getting out of these exercise videos. And there's all different kinds of exercises depending on what you like. So I think this could be a real game changer for people. I'm recommending it because it's hard to go to the gym, it's hard to go to the doctor, and I think it's just a great type of technology. This is Dr. Gregory Charlop. Thanks for listening. I am available for wellness consultations for people in California and Texas. Just reach out to me on my website, Gregory Charlop, MD, or check out the book, Why Doctors Skip Breakfast, and we will catch you again real soon.